Case number 3 is not going to be a case of a meniscal tear, okay? It's not going to be a meniscal tear. I mean, there may be a meniscal tear there, but that's not the reason why I'm showing you the case. In fact, there is actually a meniscal tear here, but that's not why I want to show you the case. I want to show you the case for a different reason. I want to start with the sagittal T1s as I always do. I think it's very important to get into a habit of looking at things. So I'm starting laterally. I'm already noticing that there's a little bit of signal within the posterior lateral tibia, maybe the anterior lateral femur there. Okay. Maybe, yeah. Maybe some meniscal signal right here, but you want to look at it on a proton density or a T2 weighted image. Okay, so there's something going on there. I'm going to turn to the sagittal T2s. Okay, and then look at the marrow. Oh, wow. Okay, so I'm already seeing marrow edema along the anterior lateral femoral condyle right here, posterior lateral tibial plateau. Okay, so these are likely microtrabecular contusions that have occurred. If I go immediately, I'm also seeing bone marrow edema along the posterior medial tibial plateau. Okay, so there are microtrabecular contusions. These are like micro fractures in the bone. Okay, that's what this is. The patella overall looks okay. So I want to bring Ashley in here to ask question number 4. Okay, so based on this, what soft tissue structure is injured in this patient that has bone marrow edema in both the anterior lateral femoral condyle and the posterior lateral tibial plateau? Is it the ACL, the PCL, the medial collateral ligament, or the medial retinaculum? Which soft tissue structure is injured based on the marrow edema findings that you're seeing here? Okay, so 89% of people got this correct. The ACL, the anterior cruciate ligament. That's exactly right. Okay, good. So this is a pivot shift injury, right? This is a pivot shift injury. When you get marrow edema along the anterior lateral femoral condyle, as in this case, and the posterior lateral tibial plateau, that should ring alarms in your brain automatically. Okay, this is a pivot shift injury. The ACL will be torn in 100% of cases. Okay, in every case that I've seen of this, the ACL has always been at least partially torn, if not completely torn. Okay, this is a pivot shift. This happens in people that, like skiers or American football players. Okay, when a valgus load is applied to a knee with the femur either an internal rotation or the tibia an external rotation, right? So if a valgus load is applied to a flexed knee where the femur is internally rotated or the tibia is externally rotated, you get this pivot shift injury mechanism where you get, loading on the ACL, and the ACL is pretty much torn, okay? And you get these microtrabecular contusions in these areas. And I'm going to show you the ACL, which is right. Look at that. Look at this ACL. It's thickened. There's fluid transecting, the mid substance of it. It's not. That's a complete rupture or a complete tear. You can't trace all the fibers, right? Because you have this fluid discontinuity right here in the middle of the tendon, right? Of the ligament. Excuse me. So this is a complete tear of the ACL with a pivot shift mechanism with bone marrow, microtrabecular contusions along the anterior lateral femoral condyle, the posterior lateral tibial plateau. And in fact, the reason why I'm showing you this case is that bone marrow edema patterns in the knee are extremely, extremely important. Okay, the bone marrow edema patterns predict the soft tissue structure that's injured. Okay, so if you get this is one of 5 marrow edema patterns that's recognized as a classic pattern that predicts soft tissue structure. This is known as the pivot shift mechanism of injury, right? If you get marrow edema along the anterior lateral femur, posterior lateral tibial plateau, the ACL is always injured. There's 4 other classic contusion patterns that I'm actually going to show one of them later on in this talk. But this is the pivot shift mechanism of injury. Okay, and I want to show you another finding in this case. So this is the medial meniscus. Again, notice that the posterior horn is double the size of the anterior. There is a little bit of signal here. It's not really going to the inferior, the superior articular surface. So maybe it's likely degenerative signal or mucoid degeneration within the meniscus without discrete tearing. But as we come laterally, you look at the anterior horn, the posterior horn, there is a little bit of signal here, kind of going to the superior and the inferior surface there. Okay, it looks a little abnormal. It's seen on 2 or 3 slices. If I go to the coronal sters, I'm going to focus on that lateral meniscus there. Okay, so yeah, there's signal here, right? This meniscus is torn, right? There's a tear that the periphery of this of the lateral meniscus, right? The posterior horn of the lateral meniscus. This is, anteriorly, right, where the meniscus is, attaching with a transverse ligament along the tibial root attachment. And then if we go posteriorly, it doesn't look that great, right? This may involve a root. This may be a root ligament tear as well along the posterior root of that ligament, okay? And you can see part of the tear, it's sort of a complex tear. There's some signal here, there's some signal there, so this lateral meniscus is not looking great, okay? So you can see the nice microtrabecular contusion here along the lateral femoral condyle. Okay, you want to make sure there's no chondral defects, right? So this is the marrow. This hypointense dark line is the cortex, and this gray intermediate signal is the articular cartilage, right? So you want to scrutinize this cartilage well. I like looking at it at the coronals the best, okay? Especially the femoral tube, the medial and lateral femoral tube compartments. I think the coronals is the best. For the patellofemoral compartment, I think the axial is better to look at the articular cartilage. You can see the cartilage better, but you want to make sure that the signal is preserved and it's nice and gray. If you start to see fluid signal, there may be a defect in the cartilage. It can be partial thickness, or if it involves the entire thickness of the cartilage, it's a full thickness. Here, the cartilage actually looks relatively preserved, okay? When you have intermediate signal within that cartilage, there's debate whether that's normal or that could be chondral degeneration or early chondral degeneration. But here, the lateral compartment cartilage, I think, looks okay. You can actually also see the ACL. This is the ACL right here. Look how it's, it's amorphous. It's not well defined, right? There's fluid all around it. This is a torn ACL, right? The PCL, on the other hand, which is this dark hypointense structure, is preserved, right? I can see it. It inserts extra-articularly about the proximal tibia. And if I trace it proximally, I can see it inserting right there along the medial intercondylar notch. That's a normal PCL, okay? Good. You can see here too, look at this fibular collateral ligament, grade 1, maybe grade 2 sprain of that fibular collateral ligament proximally, okay? Other findings here as well, okay? Come back to the sagittal. We can again take a look at these. Here there is probably a small joint effusion, right? This is more than just physiologic. There's likely a small suprapatellar joint effusion. The quadriceps tendon looks intact. The extensor mechanism of the patellar tendon, I think probably looks okay. There is a little bit of prepatellar soft tissue edema here, edema along the posterior joint capsule here, right? So those are all findings that you want to kind of take a look at when you're reviewing a case like this, okay? So this is a pivot shift injury. They can be associated with meniscal tears, both medially and laterally. In this case, we had a lateral meniscal tear, but the pivot shift is 100% of the time is associated with an ACL tear, as we saw in this case. The anterior cruciate ligament is torn. When you have the moral of the story in this, the teaching point here is that when you have marrow edema along the anterior lateral femoral condyle, posterior lateral tibial plateau, as in this case, the ACL is totally torn in those cases. Okay. All right, good.